All right, so while that's happening, I'm going to go ahead and start to introduce our next speaker for today. We are very excited to have with us Leah Kennon, who is a certified vet tech and medical director for the Feral Cat Coalition of Oregon. And we're going to hear all about the vet tech's perspective during her presentation, which I think, if you've been following along so far, is super critical to all the work that we're doing. And we talk a lot about veterinarians, but really we could not do any of this work without vet techs there to keep things running smoothly. Leah Kennon is, like I said, a certified vet tech who has worked for over 2 decades to improve the welfare of feral and free roaming cats in a high quality, high volume spay neuter setting. Under her leadership, the Feral Cat Coalition of Oregon has performed over 135,000 sterilization surgeries on primarily free roaming cats, with 8,000 surgeries performed annually.
All right, thank you so much for having me. Thank you to United Spay Alliance for having this conference. I think it's really important to talk about spay neuter and spread the word. So I'm talking about from a veterinary technician's perspective, why do technicians work in spay neuter and why do they stay? So what do I know? Who am I? Why is this my perspective? Well, as the title suggests, this is mostly my perspective as a veterinary technician. I've been working in spay neuter field professionally for over 26 years. Before that, I was a tech in private practice for about 12 years. So I've been around for a little while, working this whole time as a technician. I've leaned heavily on the resources listed on the next slide. For information. They go into much more depth on these issues than I can, and I highly encourage you all to look up at these resources and learn as much as you can. They talk about the shortage that we're experiencing and some of the things that we can do for it. I want to mention that just for the purpose of this presentation, I'm using the term veterinary technician or technician regarding a person who's passed the VTNE, which is the national exam, is licensed and registered in their state of practice. I'm well aware and appreciate the veterinary technicians that are in states that do not have credentialing. I think there's 10 or 11 of them still, and they are also very talented and much needed in their clinics and very important to their roles. But I didn't want to say the word credentialed veterinary technician over and over again, so that's what it means in this presentation. Here are those resources. I have 2 slides because I kind of forgot that you'd have access to my slides. So I thought you could screenshot them. At the end, if we have time, which I think we will, I'll kind of go through some of them to kind of tell you what they're about. But these are just some of the ones I looked into. And, we all should be having our spay neuter guidelines. We probably have those in our clinic libraries. And then the AHA veterinary technician utilization guidelines are also really, really good as far as helping us know what technicians can do in your clinics. So I think we have a poll now. Is that now?
All right, I'll go ahead and queue up your first poll.
Thank you.
Yeah, and so hopefully this is the right one.
It won't matter.
What do you think is the main reason veterinary technicians want to work in spay neuter? So go ahead and click on your screen, submit those answers for us, and I will share those. I always like watching folks vote. So why do you think this is the main reason that techs want to work in spay neuter? Go ahead, get those votes in. I'm going to give you just a couple more seconds. Is it for the love of the animals, looking for an easier job, a sense of purpose, or they just love to clean things? All right, 3, 2, 1. I'm going to close that and let's share the results. 47%, it's a love of animals. And no one said that it was because the job's easier or because they love to clean. 53% said it's for a sense of purpose.
Great. So those are big reasons why technicians work in spay neuter. The sense of purpose is number 1. It's the #1 reason why technicians, in my opinion, and also from some of the research and surveys, that they work in spay neuter. And it's a reason why we need to be really clear in our mission and share our mission. And obviously our love of animals, which is going to make our purpose more important to us. So thank you for participating in that. So the next slide talks about why veterinary technicians are important to your mission. Well, you know, we usually in high volume spay neuter, our mission involves doing a lot of surgery. And if we have technicians, we can do more surgery. So they allow us to be more efficient, and the veterinarian can do what they need to do while the technician is taking care of the things to getting the animals ready for surgery. So it's really important that the veterinarian's doing what only the things that veterinarians can do, which in our case, a lot of it is surgery, then they're not having to come out to induce animals or intubate them. They're not having to come out to handle emergencies. They can do what they can do, which is spay and neuter animals, and that's going to help us do as many as we can. Technicians can be the face of your medical team. They interact with your clients. They can do wellness visits. They can manage your clinic. They can create programs. They can run programs. They can be leaders of your teams. They can be leaders in your organization. So, you know, just I encourage anybody who's out there that's working in management or in boards that you look at your technicians as more than just the labor of getting those animals ready for surgery, that they can be much more than that. And you'll be able to broaden your mission and reach your mission if you utilize your technicians to their highest potential. They improve the quality of care for your patients. They can recognize, they can respond to emergency, but they can also recognize when the emergency is about to happen, when something's going to happen with an animal. They can be on top of it. Your veterinarian, once again, is doing surgery, so they're not usually with those patients that are going down, that are being induced anesthesia. They're not with the recovery patients. So you can depend on your technicians to take care of your patients, and you're going to have, you know, a better outcome because of that with your patient care. And then, like I said, it allows your potential to grow your existing program. For instance, if you add a technician, sometimes either one, you can now keep up with the vet that you have, because, you know, oftentimes our vets are faster than the techs. They're faster, but, you know, their 5-minute spay, their 3 to 5 minute spay, is faster than it takes us to sometimes induce and prep and provide all the services to the animals that we're getting ready for their surgery. So if you add another technician, you can keep that. You can have a better chance of keeping an animal in front of your surgeon at all times, which is super important. Just like Dr. Mann said yesterday in her presentation, you want that veterinarian to be your bottleneck. You want them to be the ones who are holding things up, not the rest of the team. Also, adding a technician could maybe allow you to add another veterinarian, which could maybe double the amount of surgery that you're doing. So they're very important to your mission, which is usually involves increasing surgical capacity so you can help with the overpopulation issue. It doesn't matter if the technician is credentialed. Well, it depends on what state that you're in. If you're in a state that requires credentialed technicians to do certain things, then yes, it does matter. So in Oregon, for instance, technicians cannot prescribe, diagnose, or perform surgery. So those are things that only veterinarians can do, which we want to keep our we want to keep everybody in their lanes so that our teams operate as efficiently as possible, and it also keeps everyone happy and fulfilled in their jobs. And utilizing technicians is one of the #1 reasons why technicians leave. So it's something that we want to make sure that we're doing, not only for our mission, but also to retain the technicians that we have. So veterinary assistants, who in Oregon, we call what other states might call technicians, but in Oregon, they're veterinary assistants because they're not licensed, but they are doing a lot of work in the clinic. But what they cannot do in our state is they can't induce anesthesia, they can't intubate patients, they can't give rabies vaccines, they can't insert a microchip, although I think that's changing, which is good. And they can't take radiographs until they take a radiology certification course. So along with the things that credentialed technicians can't do, the veterinary assistants can't do those as well. So you can see that if you don't have a technician in your clinic that is credentialed in the states that require them, you're going to have a veterinarian who's going to have to come out and induce anesthesia, give all the rabies vaccines, which I know they can do in the surgery room, but it still can slow them down a little bit. They're going to have to come out and do all these things that if you had a technician, they could be doing while the veterinarian is continuing to do surgery. So I would encourage everybody out there, veterinarians, technicians, management boards, to check your Veterinary Practice Act for the state that you're in to see what technicians and assistants can legally do in your clinic, and then create a plan to utilize everyone to their highest potential. So why do veterinary technicians work in spay neuter clinics? You know, they enjoy a sense of purpose, just like the poll said. That is number one. That's they want to work, they want to make a difference. And when I interview technicians to work for us, you know, I'll ask them, why do you want to work for us? And number one, they always say they want to make a difference. They want to do something besides make money for a corporation. They want to do something. The reason they got into veterinary medicine was probably to help animals because they love them, as we also saw in the poll. So they really like that sense of purpose. They enjoy the teamwork aspect of it. High volume spay neuter clinics require a teamwork aspect. Like you have to have a well-run team in order to be as efficient as you can in order to produce as much surgery as you can. And a lot of technicians and the rest of the staff, once you have that well-oiled team and it's really running well, I think many of you can attest to this, it's really pretty fun. Like it's really fun when it's all working really well and everyone knows their jobs and everyone's covering, you know, like covering each other's back, and the cats, in our case, the cats are all getting the best care possible. They get to use their skills, and they often get to use their skills in a more independent way than they would in private practice. They don't have a veterinarian standing over their shoulder, you know, maybe doing the things that the technician could do, or, you know, telling them what to do each and every step. With well-written and well reviewed and honed protocols, the technicians can be much more independent. And it's tangible, you know, at the end of the day, you know you've made a difference because every animal that's there that day is going to have a better life. And not just that animal, but the people who care for those animals. We work primarily with free roaming cats, and so this cat in this slide is a good representation of the guys that we see. And you know, most of you who work with also with TNR patients and clients, you know that they are very attached to these cats, and they really want to take care of them and continue feeding them. They just don't want more. So you've made their life better that day as well. And as we all know that we do this because we love animals, but you know, we're compassionate for people too. So they get to learn new skills. I really enjoy introducing new skills to technicians, whether they're animal handling, how to handle feral cats, the differences in our anesthetic protocols, why they're different, just all the things they learn and do that they might not do in private practice. And they get to do a lot of it, and they get pretty good at what they're doing because they're doing a lot of it. So we used to, when we did low-income pet cats before COVID, when we had capacity to do that, we were at that time still using some IV anesthetics. We were inducing with cat bowel, and then we were intubating all those kittens. And so I would tell technicians, I'm like, you know, when you move on, you're going to be taking a really valuable skill to your next clinics because you'll be able to intubate anything. So, and then accomplishing a goal, I think it's really important. Most spay neuter clinics have a goal. You're usually trying to reach a certain surgery number. And I think it's important that you have that goal. Technicians like to have that, and the team likes to have it. It encourages the team to work and keeps everyone going when days are really hard. So this is an example of our mission, and this is just our mission, and this is an example of what our guiding star is. For me and my role, I have always used our mission to help me make decisions, because it's really easy to get mission creep. It's really easy to try to do other things. But if your mission is what ours is, or to reduce population, you're going to probably stay focused on spay neuter. So the mission of the Feral Cat Coalition of Oregon is to reduce the population of free roaming cats and improve their welfare through spay neuter programs and education. So I think we might have another poll. No.
We sure do. Let me go ahead and get that up for you.
Thanks. I might have missed it.
All right. And how many credentialed veterinary technicians work in your clinic? So if you're out there and you work for a clinic or you're affiliated with a clinic, how many work in your clinic? Go ahead and click on your screen. I think we have a lot of folks clicking. I'm going to leave this open for a few more seconds, so go ahead and get those answers in there. I think we have a clear winner. I don't know if you want to take bets on how many vet techs probably work at most clinics. All right, 3, 2, 1. Let's go ahead and share those results. And so 17% of you said 0. The vast majority, 58%, said 1 to 2. 8% said 3 to 4, and 17% of you have 5 or more vet techs working in your clinics.
Great, that's awesome. I mean, the ones that have 5+. I remember those days. So that's amazing. And yeah, 1 to 2 probably is the standard. And there are a lot of clinics without any, even in these states that are requiring credentialed technicians. I know there's several veterinary clinics in our city of Portland that don't have any credentialed veterinary technicians right now. So they're hard to find, but having 1 or 2 really helps. Having 2 is even better than 1. So thank you so much. So why do technicians stay in spay neuter? We know why they work for us, so why would they want to stay? You know, we get to squish those chubby cheeks like that white guy. He was a huge cat. Look at those cheeks. Snuggle kittens, which is really fun. We all love it when the kittens are in until they're waking up and all meowing. But, you know, those are reasons why a lot of people think that they stay. Like, isn't that fun? But I want to say that we are veterinary technicians, and wherever we work, we're going to be working with animals. So we're probably going to get to play with kittens anyways. We might not see these chubby cheeks because private practice doesn't see that many big tomcats. But what are the real reasons that we stay in spay neuter? Not saying those aren't perks, because those are amazing perks. But it's that meaningful work again. It's our mission. It's making a difference. And so the more that you can involve your team in your mission, and the more that you can live your mission and know your mission is really important for getting your technicians to stay, hooking them in with that mission, and then working to achieve your mission. Fair compensation and the utilization of technicians has historically, since the beginning of the 2000s, been the reasons why technicians leave the field, leave their job and leave the field altogether. They're not getting used and not getting paid well. So if you're paying your techs well, they're going to stay with you. You know, technicians are at an extreme shortage right now, and they can work anywhere. They can work anywhere, and they can make more money probably somewhere else. So make sure that you're paying them fairly, and don't rely on their love of animals for having them make less money to work for you, because they will go work somewhere else and they'll come volunteer for you. Job flexibility is super important for technicians. It's very important if you can offer as much flexibility in their schedule that you can. It's very helpful, especially when we're working kind of in a niche like spay neuter. A lot of technicians want to utilize the rest of their skills. Some techs like doing dentals, and if you don't offer dentals, they might want to go do that in private practice. Some programs like ours, we don't really get to offer very many health or pet benefits for technicians because we're a spay neuter clinic only. So, you know, if they've got a dog who needs medical care, they might want to work at another clinic so they can get discounted care for their dogs. Most technicians have animals, obviously, and a lot of them have special needs animals because they take them home from work. So what we did, one of the things that we did was we created a position for technicians, well, for all of our staff, that they could work a 30-hour full-time week and get full-time benefits like health insurance and paid holidays. And that allows them, they can work 3 10-hour days for us, and then they can go work somewhere else. That also keeps them kind of tied to you. You know, we have technicians that go work for corporate clinics on the days they're not working for us. And sometimes, you know, that corporate clinic or wherever they're working, doesn't have to be corporate, we'll try to get them to work more hours for them. But if their health insurance is tied to us, they're probably going to stay with us a little bit more. So It's a little strategic, but it also just provides flexibility. Be flexible with their schedules as much as you can. If they need time off, try to make it happen. That's important to technicians, especially in this day and age. They really enjoy the teamwork. They can become very loyal to the team. The team gets pretty close, and they become pretty loyal to the mission as well. So if your team isn't flowing, you need to do something to try to make it flow better, because that's really important for getting your techs to stay. And then showing appreciation for their work. The more appreciation you can show, and it's really going to make a difference when you're asking them to work harder, which is often going to happen when when you're short-staffed. So, and that's more than just a pat on the back, and it's more than a coffee card. It's just really a very personal, give something that person needs. If it's money, if it's a gift card, do something to mark that you appreciate what they're doing, as well as all the thank yous that you can give them. And talking about technicians in your program, that helps. Practicing modern medicine, which in those studies that I posted in those articles, they talk about modern medicine a lot. And what they mean by that is by practicing good medicine. So if you're practicing good medicine, they're going to stay. If you're not, they're probably going to move on, as well as your vets, because they want to be affiliated with people who are an organization that's practicing good medicine where they can practice their skills. And then the technicians like to have a sense of independence in their job. So they start to really enjoy that. They feel like their skills are being utilized, and they feel like they're making a difference, and they enjoy that. And then accomplishing a goal again. I think goals are important. They can go the other way as well, like too driven to reach that goal. But if you can make little mini goals along to your big goal and really stop and appreciate and say thank you and make those smaller goals really memorable, that's how you're going to reach your bigger goal, and you're going to reach your organizational goals. So then why do they leave their jobs? And ultimately, oftentimes the profession. Low pay, I think, is number one right now. Techs can go work anywhere, and they can, like I said before, if we're not paying them, it's just kind of a show disrespect for the technician role. So I just suggest that you think of them kind of like you think about your veterinarians. If you need to pay your veterinarians more to keep them to stay, you probably need to pay your technicians more, as well as probably everybody else. If you don't allow them to use their skills, if the veterinarian keeps jumping out and doing their job for them, they're just going to get frustrated and want to go somewhere where they can utilize their skills and be appreciated and respected a little bit more. All these things just lead to burnout. Burnout can come from, constantly being overworked, constantly being asked to do more. If the organization doesn't adjust their goals to the staffing level, that can cause a lot of burnout. If you're not getting appreciated by the management, all these things, you're going to have decreased job satisfaction. If your team isn't working great, if somebody's kind of that cog in the wheel that's kind of making the team not work well and it's not addressed, they will leave. And that lack of job flexibility, technicians really, really want that, and so do veterinarians. So anything that you can do to show that you're willing to be flexible is important. And then the lack of modern medicine, you want to be having good protocols, listen to your technicians when they have ideas, because they're the ones who are taking care of the patients and see the patients while you're in surgery. And this is just a picture of our clinic manager mopping, which obviously we all do mopping, but sometimes when the rules get flipped and that's what you're doing instead of something that's maybe of higher value to the organization, then morale can certainly go down. And when technicians leave, it can result in the following and more probably. But obviously when a technician leaves, you're going to have a hole in your team. You're going to have less productivity. You're not going to be able to produce as much surgery. And I will say from experience, you may be able to produce as much surgery for a short amount of time, but it will burn everyone out. Everyone, because it's hard work. So the organization needs to adjust their goals when you are short-staffed. And I'll probably say that a few times, but it's really important in order to not create burnout. But if your technicians leave, you might not be able to reach your organizational goals. You may need to adjust them, like I just said. It creates a sense of loss in the team. The team, is pretty tight. And when one person leaves, it shifts things. It shifts roles, it shifts responsibilities. And sometimes you find the gaps. And since we had a tech leave not too long ago for health reasons, and we realized after she left, she was doing all the laundry. I was like, whoa, didn't realize she was doing all of the laundry until the laundry wasn't getting done. And the only thing different was that she was gone. So not really the best use of her skill set, but she was also very good at making sure she was busy at all times. And one of the things she did was always constantly throwing laundry in. But it can create team turmoil for a while. And it takes some time. If you can hire a new technician, it's going to take a little while to train them because they probably haven't worked in high volume spay neuter before, and it is different than private practice in many ways. And it takes some time. It takes time for them to see everything that's going to happen that they need to know about. So it takes a little time to get the team back up to speed and where you can be back to those goals that you were prior to losing that technician. And then the last thing that can happen, well, I'm probably not the last thing, but the last thing I have that can happen when you're understaffed all the time. It just becomes a normal thing and becomes a cultural thing in your organization. And this can create burnout, and it causes more people to leave with attrition. So that just means if you're understaffed and you're constantly saying, like, we're not meeting our goals, what's wrong? That makes the team feel really defeated. But if the goal is something that's reachable and attainable for the staff that you have, you can create that well-running machine again and perhaps get up to higher numbers with that smaller staff until you can get another staff. But if you're constantly saying, oh no, you're not doing enough, that is just defeating and will burn people out. I say that, maybe we've experienced it. So this is just a slide to show you, like in our clinic, fewer surgery patients. If we are down techs, we might have 30 patients with one bed and one tech, depending on who the bed is. Maybe we could have more, but the clinic's not being used. We've got open tables where we've got, surgery capacity that we're not filling versus a full clinic. This isn't a great picture, but it's just kind of the one I had of just a bunch of traps in the clinic. Oops. Like if you've got a technician or two of them, you can do 80, surgeries with a couple of veterinarians in the same amount of time. So it's just way more efficient and it's way more cost effective. So I think we might have one more poll.
Absolutely. I'm
sorry, it's not in order.
No, you're fine. Let's go ahead and launch. What has happened in your practice when a tech left and you were short technicians? So if you could tell us, less surgery was performed, the team was in turmoil, attrition of more staff, increased staff burnout, people calling more often.
I'll call you out.
Yeah. We said, please select one, but truly this probably could have been a check all that apply. But what was perhaps the biggest disruptor?
Yes, there you go.
Thing you noticed.
Thank you.
Yeah. Go ahead and click on your screen. Again, I guess this is specific to folks who work in that clinic setting or work very closely perhaps with the clinic, but what was that big thing? Give you a couple more seconds and close. Let's go ahead and share those answers. 38% of you said that less surgery was performed, which is never what we want to hear. The team was in turmoil, 31%. No one said that there was attrition of more staff, but 31% did say that there was increased staff burnout and people calling out more often, probably because they're all feeling overworked with that role not having been filled.
Yep. Yeah, so that's interesting. That's kind of what you'd want to, you kind of expect to see, but you also see the loyalty because people aren't quitting yet. That a loyalty to your mission, but because they're not quitting and because we're not adjusting the goal, they're burning out. So that will happen, and staff can only take that for so long, and it can be a long time. But when it collapses, it can be big. So I just encourage management to just try to adjust their goals when you're short-staffed, so people aren't feeling that pressure. knowing that the team is dedicated and they're doing as much as they can to do as much surgery as they can. But you can't always just overperform. So what can we do to attract technicians? Obviously, we need to offer competitive wages and benefits to help that fair compensation reason. We need to have solid protocols and procedures in place, reflecting best practices, and that's going to help them utilize their skills to the highest level. And the one thing that I talk about a lot in our own organization, and I just don't know if I say it the right way, but filling the need to raise the perception of your medical program within the local veterinary community, your medical program. Techs and veterinarians are attracted to a well-run program and somebody who's practicing good medicine. So, but the problem is a lot of veterinarians and technicians don't know what spay neuter clinics do. So that, can be a barrier to attracting them to come to the field. So talking about your mission and talking about how technicians are integral to this work is really important to overall, for maybe a technician will hear like, wow, Feral Cat really appreciates their technicians and they really need them to reach their mission. I will be needed there. That attracts people, technicians, because they want meaningful work. And then you can have local involvement with your local technician association. Not everybody has one, but we have one that is now really active, the OVTAA technician, and also the assistant association. And we have one of our technicians, our clinic manager, actually sits on their board now. And so she has a voice at the table with our local technician association, and she's able to share what spay neuter clinics do and what we do and what our mission is. So that helps get the word out there. So like many high standards attracts a high quality medical team. This is just showing, our vets are gowned up when they go into surgery. And in our state, they have to be wearing sterile gowns when they're doing a sterile surgery. But we also did it when we were running our mobile clinics. And it's just, if you can make things look a little bit more normal, which, doesn't always look completely like a private practice, but if you can make things look more like that, it will look normal and they won't automatically have an assumption that you're going to do things in a low quality way, because maybe they think we can't afford gowns or we can't afford to do things the right way. I've had technicians say that to me. And I'm like, no, that's not the case. We will do what we need to do to have high quality medicine. So what can we do to retain technicians? So once we have them, once we've attracted them, once we have them, how do we keep them? That's super important. It's really expensive to rehire, retrain technicians. And for all the reasons that we talked about, that team turmoil is a really big one, because that team, we need the team to do as many surgeries as we can do. We need that team to be well running. So, obviously, number one, we want to utilize their skill set. I like to find out what they like to do best, and then grow them in that area. Maybe make them the trainer of that area, give them some responsibility, pay them competitively, like we talked about. Don't, I still see ads out there for some shelters that say, we can't pay you much, but please come work for us. Like technicians have families and needs as well. They need to have a living wage. And then you need to practice good medicine. Just because you're doing high volume or just because you're a nonprofit doesn't mean that you need to cut corners. Doesn't mean that you have permission to do things in a way that's not a high quality. So make sure you have solid protocols, have them reviewed by veterinarians, make sure that everyone's on board, and make sure you have a good training system so all your staff, your technicians, and your veterinarians are following your protocols that are set up. And then provide a path that encourages professional growth. One reason I've stayed in this field for so long is that I have had a reason. I had been provided flexibility with my job. When I first started, I was a single parent to a son that had a severe medical condition, and I couldn't work sometimes because he might have been on chemotherapy or having something done to him. So I needed some flexibility, and that is one reason why I stayed with this job for a long time, was I needed that flexibility. And obviously the mission, my skill sets, I was able to use not only my technician skills, but also other skills that I had, management, leadership, writing skills, all those things. So I was able to feel fulfilled. I started as a technician. I mean, I've worked as a technician the whole time, but I was given more responsibility as things went. I was a clinic director. I ran our mobile clinics for 15 years, creating all the job descriptions and the volunteer things and the clinic flows and all those protocols and procedures. And then became the operations director for the organization, doing more of that. And I'm now the medical director. So I've had a path of growth, which has kept me. It's kept me here, and I think it's been good. So these are all very important. The mission, making sure the workload is balanced. You know, that's something that I just know as a manager is something that can bring down attitudes and the team really quickly if one person perceives or is working harder than the rest of the team or doing more of the job. Like, it just gets out of balance. So if you're managing the clinics or even if you're working them, just make sure that you're working as a team, and that means the workload is balanced. And then one thing I hear from credentialed technicians a lot, and reasons sometimes they leave their jobs to come to us, is because they're working in an environment where the management is allowing people to do technician duties, but they're not credentialed to do them. So for instance, you might have a veterinary clinic that's allowing veterinary assistants to induce anesthesia. Credentialed technicians are not going to stay at that clinic for very long. So even though we know that people can do different things, if it's not their job, they shouldn't be doing them. That doesn't say that you can't be trained and cross-trained, but you want everyone working to their highest purpose as much as possible. So this is just showing like our techs intubating, our veterinarians in the background doing surgery. And they feel, you know, a lot of independence being able to do things on their own. So let the vets do the surgery. Did I miss one? Nope. So the bottom line, the technician shortage is real and it's getting worse. It's not going to go away in the next year or 2 or 5, probably. It's here to stay for a while. If we don't get better working to change the perception, like we need to work together to change the perception of technicians and to utilize their skills. We're just going to continue to face this battle. So a lot of things are happening recently to help technicians be utilized more, and the more that we can do that, the better. I highly recommend reading those AHA technician utilization guidelines. Implement some of the steps, and that will improve your culture and organization regarding technicians. Sometimes technicians are kind of considered like the grunt workers, for lack of a better word, you know, because they are willing to do most anything. But that doesn't mean that you need to take advantage of that. Pay them more than you think they should. This not only addresses retention and recruiting, it helps attract people to the field. I'm kind of famous in my little corner of the world for saying that if everyone just paid their techs $10 more an hour, we wouldn't be talking about this as much, and it would help attract people to the field. But that's a real barrier for a lot of reasons. But you know, get your board and your upper management involved so that when budgeting comes around, they can budget appropriately. You know, it kind of like makes your heart sink when you think that maybe there might be some more compensation coming, and then the manager says, well, we didn't budget for it this year, so we'll have to wait till next year. You know, next year might be a while away. So get them involved so that's not the answer, that we didn't budget for it. And then make sure you're budgeting for it and you have a development plan that you can pay your staff. So at the end of the day, you know, I talk a lot about roles, but you know, all the work needs to get done. The patients need to be cared for, they need to be checked out, and everything needs to be ready for the next day. It's important to have fun. It's important to laugh when you're kind of fake mopping the floor like she is right there. And come together as a team when you're not working super hard, and you can kind of talk about the day and prep for the next. Keep the workload balanced and everyone will respect you for it and everything will run better. These are those resources again. And this is me. So, you know, kind of in summary, I just want to say, you know, the veterinary technicians, you know, are the backbone of the spay neuter clinics. They blend their surgical expertise, their anesthesia management, their patient care, and client education to ensure, you know, that you're operating in an efficient and compassionate way. And their involvement is essential, not only for the clinic day-to-day operations, but also for the broader goals of animal welfare and population control. So this is me. If you have any questions that we don't get to answer today, you're welcome to reach out to me at the Feral Cat Coalition of Oregon. Thank you so much for your time. And I think we have time for questions.
I thought we had a couple comments during your presentation, so just kind of hitting on those. And I think it's Jennifer, I think, who's actually our state leader out in California. She said that our technicians stay because there's no on-call, there's no weekends, there's no emergency. So I'm just wondering if you could kind of speak to that, just the culture of, a spay neuter clinic means you kind of have, set hours, and I guess that's a better work situation.
Yeah, you have set after hours. You aren't going to be staying late at work usually. You have set days that you're working. Yeah, you don't have a ton of client interaction. You know,
Hmm.
that's oftentimes a perk for the veterinarians and for the technicians. Your clients are overwhelmingly grateful. So we're not dealing with a lot of the angry clients that are mad about their bills or whatnot. Like almost everyone who uses our services are extremely grateful for what we do, and that really helps with the compassion fatigue aspect of things when you're getting gratitude coming back towards you instead of just complaining. Not that there isn't some of that, but I will say that most of the complaining in our organization comes from more of the trappers, transporters, rescue groups who are desperate to get more services, and there just isn't enough to go around to everybody. So yeah, I agree. There's those perks for sure.
Yeah. And then another perk I think I heard you mentioned, and Donna said that providing all of the vet care free for my pets would help keep me at a clinic as a tech who left because of the low pay, she said. So is that a benefit you said is like certain vet services? Like,
Well, for veterinary technicians that work in private practice, will often get discounted veterinary care. That is changing a bit with the corporations, but they still will have discounts and veterinary care for their animals, or maybe discounted prescription foods and prescriptions. So a lot of techs, like I said, have special need animals or animals in general, and that's very, very important to them. So it isn't, so spay neuter clinics, they can offer vaccines, they can offer the things that they do for their
mhm.
employees, but it's hard to offer more full service veterinary care for their
Yeah, but thinking
employees.
outside of the box as far as benefits that could be of interest to folks specifically in this field, like you said so often, and I think the trappers agree, like we end up with the animals that aren't going to make it through your normal fluffy kitty adoption weekend, that everyone's clamoring to get. We end up with the harder cases. And so I think including those types of benefits and, maybe it's pet insurance or something like that, that could.
Yes, and we are looking into pet insurance. It's just, I guess, finding a group policy isn't that easy. Um, they're all individual policies. But that is something that we are definitely looking into because it's important.
It is, and it shows that you are, I mean, it's again living that mission, I guess. I see that as an extension of the mission, an extension of understanding what's important to the people who work for you. And so
Yeah,
thoughtful benefits, I guess, can go a long way.
yes.
Um, we had someone say that to attract more people to the vet tech field, I would advocate for better externship programs. I recently became an RVT in California, and my externships were very stressful with very little support. And I know that many students left the program due to the attitude of staff at the clinics.
Yeah,
Huh?
agree with that. And from the other side, it's hard, a little bit hard to fit them in without knowing their training, and to give them meaningful work to do. So there isn't a lot of like preparation for the clinics who are taking them as an externship to provide meaningful work for them to do. So in a busy spay neuter practice, I do find it hard to give them enough. They can prep and they can see everything that's happening, but it's not like working in private practice where they're doing more like X-rays and lab work and dentals and more exciting things. They think it's exciting. Um, yeah.
Yeah.
I agree.
Um,
Yeah. It would be
yeah.
nice, when I went to tech school many years ago in Colorado, I went to Bellray Institute of Animal Technology, and they had their own hospital that we did our rotations through. So we did rotations through the clinic that was run by the school, and a lot of the teachers worked there as veterinarians. So I thought that was a really good benefit, and I came out of school feeling very well prepared. But I can see where if you just are going in and doing your internships and you're kind of at the mercy of the clinic to allow them um, to do things, it can be hard.
And you spoke a little bit to this, but the opportunities for leadership and opening those pathways for veterinarian technicians. I mean, I'm wondering what are the most important leadership lessons you've learned, maybe for yourself, but also, mentoring other vet techs who have come, that you have been able to work with, coming behind you as well.
Um, I think just empowering them to make decisions, empowering them um, to do their job, like utilizing their skills, which sometimes just takes, working with the veterinarians a little bit and talking to them. A lot of veterinarians aren't utilizing their technicians because of a lack of trust, because it's a veterinarian's license on the line, that sort of thing. I don't think that comes in as much in spay neuter because the veterinarians are really busy spaying and neutering. But I would encourage technicians to ask your supervisor, if you want more responsibility, ask for it. And that's how you get kind of go up the ladder. The more responsibility you take, the more you perform, then the management like, oh, maybe you could do this, or oh, would you like to do that? Bring your ideas. Don't be afraid to speak up. Often the technicians know what's going on. They know the people that we're helping, they know the patients, they know the veterinarians. If you've got an idea, or if you see a need, or you want something changed, just speak up about it, because otherwise you just start feeling frustrated. And sometimes it's great, and we're like, yeah, let's do it. And then they feel empowered because their idea is done, and it's helping the mission, and they get recognized for it. I'm not sure that answered
For
it,
sure.
but
No, I think that's great. And I think I mean, recognizing that there's value in everyone and those ideas,
mhm.
accepting that, hey, oh, let's see what opportunity is here. Don't just immediately shoot ideas down, but let's explore, what is there, and then give people some length to run with those ideas and see what happens. I guess we all like to feel like we're
Yeah,
being heard, and
yes,
our vet techs are absolutely no different. We all want to be appreciated in our job. We all want to be compensated well for what we bring to our jobs. I think these all somewhat feel like common sense to say, but it is important because our vet techs, we don't
yeah,
want to overlook them. We don't want to disregard the value that they bring, because I have heard from too many places that in some cases they have vets, but they don't have techs, so the clinic's
yeah.
closed. Yeah.
Yes, yes, and that's happening in private practice as well. But it's, the technicians have kind of been not really well respected for a long time. And I think it's just kind of coming to a crisis. So I think that there are a lot of changes being made um, that is helping the technicians. So I like to say in my clinic, or our clinic, is that, we're all equal human beings. We just have different jobs, you
Mm-hmm.
know, and it takes all of us to get the job done. Oftentimes I think the clinics become kind of vet centric, really. The veterinarian has a say over everything, and the veterinarian should have the say over everything, but it should be it can be more of a team aspect, So the veterinarian is part of the team and not sitting outside of the team. They need to be part of the team. And when that happens, there's more respect flowing both ways, and you can just get more done. You really can get more done, and people are happier.
Yeah, happy teams, I just are way easier to work in all around for a number of reasons.
Yeah, and everybody who does this work, you know what it feels like when the team is flowing and everything's just going. It's really fun. I've said that so many times in my career. And, one time a volunteer said to me, she said, "Well, Leah, it's not like whitewater rafting fun." I'm like, well, to me it is. Like, this is fun, like, look at this. We're getting all these cats done. Everything's going so well, and nobody's too tired. And at the end of the day, we're not, dead, and all the cats are great, and they'll go home. And that to me is just really, really fun, which is probably another reason why I've stayed in the field so long. But I think it's fun for anybody on that team. And when you get to that point, it's cool. And that's why it's hard when one person leaves, because that team has to reshuffle itself.
Yeah, find its footing. Yeah, no, it's fun when you get to the point where you all kind of can anticipate exactly what the other person's going to do and how they're going to do it. And so you get the cats, at each station exactly when they need to be there and through the process. And you know that so and so's over there doing the laundry and the packs are going to get, like, everything is just
Yeah.
smooth. And that is like the ideal.
Yeah.
And so for anyone out there that's thinking of or working on setting up a clinic, is there like an ideal, what is your opinion on like the ideal breakdown of that team so that no one feels overworked? Like one vet to how many techs, assistants, other folks? Like, what is your ideal?
Well, it changes for everybody because everyone has a different system. For us, we want to have 2 CBTs on the floor for 1 veterinarian. So we have done it other ways. We've done 1 CBT, 1 assistant. It's most efficient to have 2 CBTs, 2 credentialed technicians for that 1 vet doing surgery. But we can also do 2 technicians for 2 veterinarians doing surgery. But it is easier to have 3. You're more efficient, you have 3. And if we have 3 veterinarians, we like to have 4 technicians on the floor, or 3 technicians and an assistant. So there's somebody moving the cats on and off the table. But I drew a line a couple years ago where we didn't want to do clinics with just 1 technician, because it's just a lot of animals under anesthesia. We don't have a lot of different volunteer help. So it's just a lot of patients to keep track of. And if you have an emergency, you really want someone there who can help. You need another hand. You need more help. So it's just safer and better patient quality for us to have 2 on the floor at all time. But it could be a technician and an assistant. But we do like to have more than 1 technician. I know it's not always possible, but that 1 technician, like, it's just best if you can spread out, you can rotate responsibilities. There's a lot of repetitive movement in this job, and you can get repetitive injuries really easily over time. Not easily, but it just happens over time. Like, I can barely lift my shoulder, my knee, my back, your wrist, your hands, all those things that you're doing the same movements for. So we like to trade out who's doing what to try to minimize the physical hardship on our bodies. So you have 1 tech, they're just doing all of the same thing all the time. You can do it for a while, but it won't last forever. They can, but that person's suffering.
And that's important to note, is the just ergonomic and physical restraints on all of us, or, on all the techs that are working in this, because I mean, you're moving cats and dogs physically around the clinic as you go through your day. So that is going to take a toll for sure.
Yeah, you're doing kind of the same movement over and over and over again. So for us, that works best, so we can rotate and we have support.
Awesome. And just a quick comment from Yvonne in the comments. She said, I volunteer in a mobile spay neuter clinic a few days a week, and it's so wonderful, speaking on the idea of how fun it is. Great people, smooth process, helping so many animals. Shout out to Animal Action League in Joshua Tree, California. So yeah, shout out to them. Very cool. As we're coming to the end of our session here, and so I do just want to ask, do you have any advice for aspiring technicians? I mean, we hear a lot about, oh my gosh, technicians are so burnt out, they're underappreciated, underpaid. But what advice do you have to aspiring technicians? Any wisdom to impart?
Well, aspiring technicians is hard because once you are in school, you're usually working as well. So you don't have a lot of extra time, but if you can get out and volunteer at some, like your shelter or your spay neuter program in town, you're going to get a lot of experience because you're going to be able to do a lot of things, probably more things than you can do in your externship sometimes. So you'll get a real taste for some of the things that technicians do, the good and maybe not so good. You might witness euthanasias, you might witness really sad things. Um, but you're seeing the skills and you're kind of also witnessing a team that's working really well together, and that's kind of intoxicating, you know. But I would just say try to get some experience to make sure it's what you want to do, and you know, don't listen to the naysayers. It can be a good profession, especially now that people are getting paid more. And there are veterinary technician specialties that you can go into. That is kind of right now considered our mid-level practitioner right now in our profession are the veterinary technician specialists. And they, you can become a specialist in anything almost. And I would kind of like to, I've been looking into one for spay neuter technicians. I just don't have enough bandwidth right now to do it because it kind of takes a lot. But, you know, you can become a specialist in dentistry or general practice. Or I have a friend who does physical therapy and got her degree in that with after she's a technician. So you can go beyond if you have a special interest. So
Lots of opportunities out there for vet techs. All right.
yes, yes.
Well, I'm very grateful to you, Leah, for bringing this information in this important subject. We knew we wanted to include the vet techs in our conversations this weekend, so we're very glad that you could be here to help us do that.
Thank you. Thanks for having me. I hope it was okay.
It was more than okay. So
Okay.
thank you so much.
All right.